Hi, I'm Nicole McGill. Today I'm presenting about stakeholders' perspectives about waiting for speech and language services for children on behalf of myself and my colleagues, Dr. Kate Crowe and Professor Sharynne McLeod. Thanks so much for tuning in to listen today. We'd like to acknowledge support from a Charles Sturt University Ripple Higher Degree by Research Scholarship in the undertaking of the research. And this research in the presentation today is based on research reported in the journal article, the reference for which is included on the screen. Most children become competent communicators. However, some children experience challenges in developing speech, language, and literacy skills. Children who do not receive adequate support in the early years are vulnerable to long-term issues with learning, socialisation, mental health, and bullying. Educators and speech-language pathologists, or SLPs, work together to reduce risk and build resilience for vulnerable children and families. Speech and language services are effective in helping children with speech, language, and literacy difficulties. However, high demand for these services means that there are often long waiting times, sometimes in excess of 12 months. While waiting for services, children may miss the benefits of specialised support in the early years, when the foundations for wellbeing and lifelong learning develop. Individuals on healthcare waiting lists have also been found to experience feelings of stress, uncertainty, powerlessness, and anger. Long waiting lists for speech and language services was one of 3 key areas of concern emerging from an Australian government Senate inquiry in 2014. The inquiry explored the prevalence of different types of speech, language, and communication disorders and speech pathology services in Australia. Written submissions were made by a variety of stakeholders, and although not specifically listed in the terms of reference, waiting lists emerged as a prominent theme. We wanted to explore stakeholders' experiences of waiting for speech and language services in detail to better understand the issues faced. Our aim was to explore stakeholders' perspectives and experiences of waiting for children's speech and language services by analysing written submissions to the Australian Government Senate inquiry. Of 337 written submissions to the Senate inquiry, 321 were able to be retrieved. Documents were read and searched for terms relevant to waiting, and 117 documents were found to include content about waiting for children's speech and language services. These documents were analysed by inductive thematic analysis. Included documents were written by organisations, parents, speech-language pathologists, and others, including academics, educators, and learning support staff. Original submission numbers have been retained when reporting the results for the remainder of the presentation. There were 3 overarching themes that were identified through thematic analysis of the documents: the duration of waiting lists, consequences of waiting, and actions undertaken to deal with or manage waiting. The first theme related to duration. Participants described waiting list magnitude and a mismatch between supply and demand. For instance, an educator described the enormous waiting times for public assistance. And a speech pathologist claimed, "Our waiting lists are disgusting." An inability to access speech and language services was apparent. A parent of a child with language needs said, "It felt as though salt was being rubbed into our wounds, as despite being so desperate for help, it was unavailable either via the public or private systems." The second theme related to consequences of waiting for services, and participants described consequences for consumers, professionals, and society. For consumers, there were impacts on children's participation, continuity of care, and emotional and financial burdens for families. A parent stated, "This is about having a voice and having access to the ability to express wants, needs, thoughts, and opinions. about having access to life. The same parent expressed that a long wait for speech and language services was like saying to the child, "Your voice doesn't matter, it can wait." Waiting was also described as a time of great despair and frustration when families were struggling and needed help. Consequences for professionals included negative impacts on their wellbeing and effectiveness. A submission from an organisation of doctors specialising in child development stated, "We can't help the kids as we should." They described the frustration of identifying language difficulties, but feeling that there was little that they could do about these due to the inadequate services available. Consequences for society included a burden or drain on services, impacting on community capacity. A maternal child health nurse described therapy taking longer and using more resources when children miss intervention in the early years. They stated, "The children and ultimately the community suffer and need not." The third overarching theme involved actions taken to manage or respond to waiting lists. Participants described consumer actions and professional actions. Consumers sought alternatives to waiting through advocacy, information seeking, and accessing multiple services. The desperation was evident for a parent of a child with feeding difficulties when they presented to an emergency department. They recounted, "I actually had to say that I would harm him if he was not going to be seen, because I was in a very dark and lonely space trying to find out what was wrong with him." One parent considered relocating their family to a capital city to access services quicker. Inaction was also apparent for some consumers, such as giving up on services. Professional actions related to speech and language service delivery and policies. Actions included indirect support and capacity building through teacher training, parent education sessions, providing advice about different strategies to try while waiting, and tightening eligibility criteria for services. Existing speech and language services are not meeting the demand or the needs of children, families, and those who support them. Consequences of waiting lists exist for consumers, professionals, and for broader society. We need to reimagine the way services are provided and consider innovative ways to support children and families until the supply of services meets the demand. As we've discussed, professionals may struggle with waiting lists. If that's the case for you, know that you're not alone. Reach out to your colleagues and seek support. Children and families may require our support and information while they're waiting, so listen to their voices, experiences, and needs. Link in with community groups, support services, or other professionals to help with aspects of children's development or to assist with managing the potential impacts and burdens of waiting lists. There's also things you can do while children are waiting for speech and language services. Check out our Waiting for Speech Pathology website. It's free. It contains information, videos, and resources about ways to support children's speech, language, and literacy while they're waiting for services. Although waiting lists often result from systemic issues, we can all play an active role by advocating for change, taking action to address these issues within our own workplaces or organisations, and supporting children and families while they're waiting. And our contact details are included on the slide. Please feel free to contact us with any questions or if you'd like further information about anything that I've spoken about today. And thanks so much for tuning in.